And finally, eventually, if the monitoring system is taken home and is going to be on the body for a longer period of time, it needs to be wearable, which means it's going to be battery operated. It needs to have a small form factor. It will have to have local processing because the data that gets collected is huge. You need to filter them, you need to compress them, you need to make sense out of them before you actually transmit them to your MD. Now, isn't it nice that semiconductor technology has all the features it takes to fill in those requirements? It offers low cost. It offers low power dissipation, small feature size, embedded non-volatile memories, microcontroller DSP, so processing power, radio solutions, all kinds of flavors, identification, and finally, very importantly, sensors. And they address all the challenges I've just been talking about. Affordability, battery operation, form factor, storage, processing power, readout, authentication, and sensing. But, as I said early on, these are just the bricks. With bricks, you don't create comfort and shelter. In order to achieve that, you need to build a home. And that's where what we call high-performance mixed-signal solutions come in. So, what you see here is a can you still hear me? So there's two elements to high-performance mixed-signal. One is that basically you see here all the ingredients it takes to build those blocks that sense the external world, that digitize the data, process the data, compress the data, store the data, make sure it runs from whatever battery it needs to run, and then eventually actuates an actuator on the body or transmits the data to the next level in the chain. So these are all functions that typically do not comply very well with what we are used to look at in this axis is the Moore's law. Moore's law is bleeding edge technology. It's going for the next 32 nanometer, 28 nanometer. I'm not saying eventually you will not need that for these functions, but you don't have to be the first one to develop it. So you can wait for it to mature. And in the meantime, in order to make sure that you have these sensors, these actuators that make, in a healthcare environment, make biologically sense, you need to add more to what is your basic process technology. You need to add chemistry. You need to add biological compatibility. And we'll see an example of that in a minute. And very important is that you'll only be able to be successful if you team up with value chain partners. A semiconductor house, no matter how bright the people in there, will never be able to be successful by their own. Especially not if you go into a vast new world like the healthcare world is for guys like us. So you need to partner, and through the partnering you can create the solutions that exactly perform against the needs and the requirements. And they will be different in a rural area in India than they will be in Chicago medical care center. So you need to tailor. Let me just give two examples. One is out of the hearing aid space, where here you see the architecture of a hearing aid device, which, if you look at this block diagram, it's exactly this, just in a different format. You have a microphone sensor, a sensitive A to D converter, a DSP and a controller. You have a radio to improve the quality of your hearing. You need radio. You have non-volatile memory. You have a power management unit so that the thing operates as long as possible from a single battery. And guess what's happening in this market? The trends are that the size goes down. Hearing aids are moving from behind the ear to in the canal, which imposes very strict requirements on size. It also imposes very strict requirements on battery consumption, on power consumption. Because if you put a thing in the ear, it's going to be there for a couple of months. You can't just replace the battery every week. By the way, there's another trend, and that is you need increasingly more processing power because the quality of the hearing experience needs to improve. So what are the ingredients for success to engage into this business? First of all, without the bricks, you can never build a home. So you need to have the comprehensive portfolio of these ultra-low power HPMS function blocks, all of them. If you miss out on one of them, you cannot build a system. Second, you need to partner with the leading OEMs in this industry. By ourselves, we can never make a hearing aid device. So it's the partnering up, the co-development, that is really the critical success factor. Now, that's what we're doing. And just naming one example, there is this first generation magnetic induction radio. You don't use an RF radio in an ear, you use magnetic induction. Why? Because it's very power efficient over a short range. It is robust against interference, and it is very friendly towards the body tissue. So magnetic induction can go through your head without being absorbed, contrary to RF. It's just one example. So this is deployed. Let me also use a bit of a more visionary example. And that's point-of-care biosensor. Imagine, well, first of all, the size of IC features, 45 nanometer, 32 nanometer, they become, equal almost to the size of molecules. So you start to get into an era where electronics could start to be, biologically relevant. So assume you would have a small silicon device that was able to, in a point-of-care setting, in a very small cartridge, take a sample of blood or urine and on the spot identify what kind of disease you're suffering from or what kind of disease you may be suffering from in future. Of course, this is a very tough challenge, but we are working on it, and I'm sure it can be done. And what do you need for that? You need biosensing technology, which is the merge of not only Moore's law, but more and more, chemistry, biology, electronics. You need pattern recognition, processing, wireless readout, encryption, and so on. And again, here I want to stress, to be successful with such a R&D project, you need to early on team up with partners in the value chain. Otherwise, you're going to make the wrong thing. And so that's really where I want to conclude. Summarizing, bringing effective healthcare to the masses will require deployment of innovation into the primary care centers and moving from treatment to prevention. Semiconductors can facilitate that, offers the bricks, but you need to do much more. You need partnerships between industries that historically have not been very good at working together. And if you can manage that, you'll develop solutions that are tailored to the application and therefore can meet exactly the needs of the rural market in India, or a medical hospital in Chicago. Thank you very much.
Thank you, gentlemen.